anything but a whole food plant-based diet, but we're not there. And in order to get a class 1A indication, which means that everyone practicing cardiovascular medicine must do this, or else you're like committing malpractice. In order to get that 1A indication, you have to have multiple randomized trials showing the effect that we suspect.
It's interesting. Thank you, Kim. I have had a number of cardiologists come to me and said, you know, Dr. Esselstyn, if you keep doing what you're doing, you're going to put us out of business. And the other point that was interesting, and in the guidelines that were put forward by the American College of Cardiology, and maybe this is a group before the one that you just mentioned, when I was writing a paper, I reviewed that, and they, in their recommendations, they contained oil, dairy, and meat. The foundation for heart disease was coming out of the recommendations of the American College of Cardiology.
Yeah, that was before the 2019 guidelines.
Well, but that wasn't that long ago. When you think about it, what were they doing in the centuries before that? I mean, that was. Yeah. All right. I'm delighted that they're coming around.
I'd like to ask another question. This question you do not have to answer. It wasn't on your list, and it's quite inappropriate to ask, but I'd like to ask it anyway. So feel free to ignore it because it's not something that I really have the right to ask. But would you be willing to share with us the list of all the medicines you guys are on? I mean, Dr. Esselstyn and Dr. Campbell, you're both 90 years old. So it would be interesting to hear, so we can compare what medicines you're on with what we're on. You don't have to answer this if it's not, it's not appropriate, but I'd still like to know if you'd be willing to each of you to share your list of medicines that you take with our audience.
I'll go.
Okay.
So I got to take 90 seconds of your life that I can't give you back and tell you a very interesting story. So I was already signed at University of Louisville to become chair of medicine. I was doing my very last rotation at Rush, and I was doing it at my outside hospital, where in a community hospital, Rush Oak Park, you typically get about 8 consults a day as the attending and do 3 or 4 stress tests. That day, it was like 8 stress tests, and the number of consults hit blackjack. So I saw that 20th and 21st patient in the emergency room, went back to get my stuff to go home, saw I didn't eat my breakfast. Okay, I won't say which brand it is, but it was just a bean burrito, and commercially bought. I ate it. Boy, oh boy. So about 15 minutes later, which means that it had to be staph because nothing else is that fast. Staph food poisoning. I was throwing up terribly, abdominal pain, ended up going back to the emergency room next to patient 20 and 21. Okay. First the pain got worse. I thought I was going to die. And then the pain got worse than that. And I was afraid that I wouldn't die. So I thought once they got the Zofran in and everything that I would convince them that I needed an abdominal CT. They ordered it, went over there, and of course I knew the tech. And I said, would you mind going up a little bit? Because I never had the coronary calcium score. Why? Because even though I'm over 60 and I'm Black and I'm male, I was one of those vegans that didn't have that 7.5% 10-year risk on the calculator, which is where we draw the line for the coronary calcium score. It is our best test. I know echo people and nuclear people will disagree with me, but that calcium score is our best test certainly for screening. So he did exactly that. He covered my whole heart. I looked at it, and you can, after you've done 10,000 of them, you can actually tell what the score is without the software. And it was about 30, not in the left main, not in the proximal left anterior descending. So I went with the guidelines. I started a statin, 5 milligrams of rosuvastatin. Got my LDL down to 70 instead of 90. It was great, but that's not the target. The target is less than 55. And that's a serious target because it really does lower the events. And so I kept going up, and it wasn't doing it until I finally got to 40 milligrams. And I just quite couldn't get below 55 until I did exactly the right thing. And some people like me are so dietary sensitive. It's not just about eliminating animals. It's refined grains, it's sugar, And it's any kind of saturated fat oil. All right. So coconut oil, I love curry. Everybody loves curry. If it's, unless it's North Indian, where they don't use the coconut oil, you have to avoid it if you have bad genes like me. So anyway, with all of that and the highest dose of statin that I can get my hands on, LDL is 42, and I do a little contest with my faculty to see who can beat my numbers. No one beats my systolic, no one beats my diastolic, or my triglycerides, because I'm running and playing tennis all the time. But I do have one guy on my faculty who beat my LDL, and I know he has a PCSK9 deficiency gene. He's just a mutant, but so I actually had he won that contest. So anyway, full disclosure, why not? The aspirin scores too low. Aspirin's a dangerous drug. You would need to have a score of more than 100 before our guidelines would say use aspirin and a statin.
Thank you.
I'll offer a comment here. That's a really interesting question. My start in this business, of course, in the laboratory primarily, got me to thinking about the risk in my own family. What kind of disease risk we have. Let's say that our genetic risk. My father passed at 70. He otherwise looked healthy and all that sort of stuff. His brother at 58. Their father, my grandfather, 73. So you might say that heart disease in my family, I suppose. At the same time, Karen, my wife, her mother had passed at 51 from colon cancer. She lost two brothers in their 50s, also from cancer. So I was really getting into this about that time when I was sort of seeing this kind of thing. And obviously for personal reasons, I said, I don't want to do that. I don't take drugs. I'm 90. My wife got colon cancer, got advanced melanoma, and she was urged, just almost with hostility, that she had to get onto drugs. She took nothing, and that was 20 years ago. And so, and the same with so this is just a personal experience. Obviously, in this case, we got to be careful how we say this. But I don't take drugs. I had a blood pressure problem a bit about 2 or 3 years ago because of a back problem I had, I thought, and I was advised to take amlodipine. And I took it for about 6 days, the lowest possible dose, and I went away, and that was it. So I don't use drugs. I use food, and I've really become quite enthusiastic for what food can really do. And we don't need to have randomized controlled trials for each and every disease to draw that particular conclusion. I would argue that on the basis of mammalian physiology and biochemistry, this is the way it works. Everything kind of works together at a biochemical sense. And so I think we lose a lot when we want to focus on one disease or one event, if you will, and then make decisions on that basis. We didn't take the vaccine either because I had the same thing because we had data from China, enormously impressive data. It's the third leading cause of cancer in the world. And so we had a lot of data there. So I came along and I saw the same thing. The whole food-based diet had an amazing effect, just the most remarkable results I've ever seen. And so we didn't get the vaccine. We got tested positive. Okay, we went through that, no problem. And so I know it's a very controversial thing. It's become very controversial. We can talk about it for days. But quite frankly, I think the whole food-based diet has a lot to offer, and we're not even recognizing how much it really can offer.
Thank you.
From a cardiovascular standpoint, my father had his first heart attack at age 43, which I think kind of put me in a little bit more of a risk category. And so after 30 years of having a career in general surgery, when I got terribly interested in nutrition, I did have my cholesterol drawn. When I first started, I thought I had to eat plant-based totally before I could ask any patients to do this. And the first time I had my cholesterol drawn, it was in the about 180s, and I really was very upset with that because I felt that I wanted to be like a Tarahumara Indian. So at that point, I gave up all the oil, and suddenly everything came crashing down, and my cholesterol was 119. And on some occasions when I've had it drawn, the total has been 107. This is without any medication or drugs. So we've tried to set an example as a family as to what we want our patients to do. And that's as far as I'll take it today.